Today, I want to discuss the signs and symptoms of sleep disordered breathing in children. If you are wondering what those look like in adults, go to our next video. I am Dr. Meghna Dasani. I am a functional and sleep dentist in Houston, Texas. And I wanted to give you the most common signs and symptoms of sleep disordered breathing in our children. The first one, and always the most common one, and the one that I think most people are aware of, is snoring. Now, let's remember, and it's important to understand, that in children, snoring may not always look like what it may look like if I were to snore, right? They don't have to have the loud snores that we would expect to see in an adult. In children, audible breathing can count as snoring. Here's a tip though. If you are ever doubtful, concerned, worried, unsure, record your child sleeping. Record how they're breathing, or what they look like when they're sleeping. And I don't mean this in a creepy way. Looks like to you, and take it to their doctor, take it to their pediatrician, to their ENT, to their dentist, and say, "Hey, would you look at this? It worries me that this is how she sleeps, or this is how he breathes," and let your healthcare provider either relieve your fears as to, it looks fine, everything is okay, or no, let's get this evaluated further. I always tell parents this. Another one is bedwetting. If you have a child that has been potty trained and has now suddenly started to wet the bed, and you've done everything that you could, you've cleaned up the diet, they don't drink a lot of water or fluids before they go to bed, remember to use the bathroom before they go to bed, and they're still wetting the bed. Remember, this is not your 2-year-old that is regressing potty training. This is a child that has stayed dry previously and has now suddenly started to wet the bed. Always, make sure you're getting their health checked out. But also always wonder, is sleep a missing part of that puzzle that constitutes why this might be happening? Another sign is a child that sleeps with their mouth open. Mouth breathing is a very serious condition that impacts growth and development. It impacts habits. It impacts how they sleep, how they breathe. If they are mouth breathing during the day and or at night, that should be a red flag for us. A child that has trouble focusing at school, has ADHD behaviors, yes, get that evaluated. But sometimes when a child is tired and is sleep deprived, those signs and symptoms can mimic that of ADHD. And it is always worth having that conversation with your child's providers. If you have a child that has speech issues, consider that they may be a tongue tie. Again, this impacts growth and development. If you have a child that's a picky eater, we got to wonder why. Why is this happening? Is that related to growth and development, which again, in turn, may contribute to them not getting the quality of sleep that we want them to get? Then there's night terrors. If you have a child that has severe night terrors, nightmares, that can be a sign as well. So these are some of the initial signs that I always tell parents to look for when we are concerned or worried that our child may not be getting enough rest. If your child is one that checks some of these boxes, talk to their doctor, talk to their dentist, talk to their pediatrician, talk to their ENT. There are so many resources available, and there's no reason anybody, let alone a child, should not be getting the quality of sleep and rest that they deserve, especially when they're growing.